My research paper is based on a historical perspective of organizations in psychiatric rehabilitation. The case study for this research is VINFEN Corporation. Psychiatric rehabilitation was formed to assist people living with psychiatric disorder get the required treatment to promote their recovery so they can achieve a meaningful life with support. This can be achieved with the use of several tools like interventions, education, employment, and housing. And my research will be looking at rehabilitation and housing as a part of rehabilitation. The research problem is to examine the extensiveness of rehabilitation in the activities of the company's portfolio and how it has evolved over time. The thesis statement seeks to prove that rehabilitation has made great strides because organizations in psychiatric rehabilitation have made improvements and breakthroughs in the rehabilitation process while housing those with psychiatric disorder. Rehabilitation can be traced back to the 19th century when the institutionalization of the psychiatrically sick were treated inhumanly, and there were advocates who spoke against it, leading to the deinstitutionalization of these groups of people between 1950s and 1970s. Housing, especially supported housing, became a form of rehabilitation when those who were deinstitutionalized were basically left to fend for themselves. Thus, a need arose to assist them by setting them up in less restrictive environment to combat the problem. The idea of housing is good because it allows those organizations to help people living with psychiatric disorder achieve their objective with the help of trained personnel who help to guide their decisions without coercion. The objective for this research is to determine what constitutes a rehabilitation. Limitations of study. No access to the financial records of the company that would give me an insight into when housing was incorporated into rehabilitation. Due to the pandemic, people work remotely, and as a result, it is difficult to contact the personnel in the company who is in charge of these records. Another limitation is time. The time to research the topic, finish and submit the study is very short, and so questions that would have thrown more light on the research topic could not be researched. Psychiatric rehabilitation has been in existence in another form centuries ago and as posited by Nathan Nelson in his book Workshops for the Handicapped in the United States, An Historical and Developmental Perspective. There was rehabilitation of those living with disabilities through the establishment of workshops to assist them by some organizations, and according to him, the organizations were St. Vincent de Paul Society, formed in 1833, the Salvation Army, the Volunteers of America, and the Goodwill Industries of America. How did they get their funding? Just like as it is today, they got their funding from state and federal governments, and also there were some private charitable foundations that were able to fund their rehabilitation process. As a result, the use of rehabilitation in the psychiatric treatment setting allows individuals living with psychiatric disorder to be able to live a near normal life in the community as opposed to being locked up in an institution. Today, rehabilitation has changed the perception of psychiatric disorder. The need for housing arose because of deinstitutionalization of the psychiatrically sick and the need for shelter for veterans with disabilities from wars who returned in the 1950s. Also, there was a dearth of affordable housing. And according to Lynn McCormick, Alex Schwartz, and Chiara Pacerini, to improve the housing situation with persons living with disabilities and mental disorders, HUD increased its involvement in providing supports and services to those who need it by collaborating with HHS, its Housing Capacity Building Initiative for Community Living Project, and to stimulate state and local government collaborations among housing and human services agencies. With the use of IROS Form 990, I was able to determine to an extent that housing was an entity on its own. Though I was not able to get the financial records from the organization's inception from 1978 to 1999, the records I had showed that in 2012, the Housing Corporation was absorbed into the mother company, VINFEN Corporation. I was also able to see that trained personnel had been employed to help with the rehab process, and just like Ms. Ital stated, staff acted as part of the rehab team while the program director as the landlord and the clients the tenants. I was able to determine from VINFEN's financial statement at my disposal that the company is extensively invested in the rehabilitation of the psychiatrically sick and that the clients pay rent, which enables them to live in the residential settings without restrictions. It has also evolved over time as shown by the organization's website, where it states that it is in collaboration with other similar agencies, and it has kept abreast with development that is beneficial to persons served. Furthermore, the company's use of peer specialists in the rehabilitation of persons served has helped to an extent because they have lived with psychiatric disorder and with the help of rehabilitation have been able to improve their quality of life, and so are examples that total recovery is achievable. I have not yet determined the method to measure rehabilitation. So far, I will measure rehab in terms of personnel and money invested because the financial records dwell on that in depth, and it is evident that the organization's existence is based solely on rehabilitation of its population of persons served to achieve full recovery in supported housing.